All right, next we want to understand the sympathetics in the thorax. The sympathetics in the thorax can be considered to be a relay system of two neurons. We have preganglionic neurons. We would have their cell bodies, and then we would have their axonic processes. And those axons will synapse with postganglionic neurons, their cell bodies, and then from those nerve cell bodies we'll have the postganglionic axon that will then reach out to innervate the appropriate thoracic structures. The preganglionic neurons, their cell bodies reside within the spinal cord at the following levels, T1 down to T12, L1, L2, and maybe as low as L3, but we're within the thorax, so we're only going to operate at T1 down to the T5 spinal cord levels. So your preganglionic nerve cell body will reside in the lateral gray horn of the spinal cord in about this location. The axon then will extend outwards and then will enter through this communication here to the sympathetic trunk. This sympathetic trunk ascends and descends along the vertebral column. You have a right sympathetic trunk, and you'll also have a left sympathetic trunk. Along the sympathetic trunks, you'll have these dilated areas, and those are referred to as sympathetic ganglia. Residing within these sympathetic ganglia are your postganglionic nerve cell bodies, and so your synapse is going to occur within here between your preganglionic neuron and your postganglionic neuron. Postganglionic axons from those neurons then are distributed to thoracic viscera, and in many cases what's going to happen is they'll leave the sympathetic ganglion, perhaps at the same level in which the preganglionic neuron entered, and come on out, or they may go up a level or two, or they may go down a level or two, and then will have their axons leave at a different level from which they arrived from the preganglionic neurons. Also, accompanying the sympathetic efferent fibers, you'll also have your sensory or your afferent fibers. So let's take a look at the specific innervation of selected thoracic viscera. So here we're looking at the sympathetic innervation of the heart. Sympathetic innervation of the heart, the preganglionic fibers are going to come from T1 to T4, maybe as low as T5. So that's going to occur here, 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 and maybe as low as here. Many of those fibers from the preganglionic neurons will enter the sympathetic trunk, synapse with the postganglionic neuron. Many of those fibers are going to ascend into cervical ganglia. And you have a superior cervical ganglion, you have a middle cervical ganglion, and then you'll have an inferior cervical ganglion that commonly will join up with the first thoracic ganglion to form a much larger ganglion called the stellate ganglion. And then you have your preganglionic fibers being distributed to the heart. You also have some from the more inferior thoracic spinal cord segments that are going out directly to the heart in this direction. So there is a question here regarding why do these fibers ascend in the neck only to then descend down to innervate the heart. And the answer to this question, again, involves embryology. Early on in the embryo, the heart resides within the neck, And then with further development, the heart will assume a lower location within the thoracic cavity, thereby pulling these fibers down so that they descend. The sympathetics are involved in increasing heart rate, and because they are also well distributed to the ventricles, they are the major player in increasing contractility when they're stimulated, and then when they're inhibited, they'll decrease the contractility or force of myocardial contraction. Innervation of the lungs is innervated from preganglionic sympathetic neurons that are housed within T1 through T5. So again, we're looking at the same levels, with the distribution then out to the lungs. Sympathetic innervation of the lungs will mildly vasoconstrict the blood vessels supplying the lungs. Sympathetics to the respiratory passageways will cause bronchodilation. And this is very, very useful in individuals that are asthmatic. If they're having an asthmatic event, you want to be able to dilate their respiratory passageways. We know the sympathetics do that as a part of their normal activity. And so you can then administer drugs that mimic the sympathetic nervous innervation, and those are sympathomimetic drugs, and then they will then produce the efficacious vasodilation during an asthmatic attack. Innervation of the esophagus is provided by the same spinal cord levels, again T1 down to T5. This illustration doesn't really show you the esophagus, but again, spinal cord levels T1 through T5 will house the preganglionic sympathetic nerve bodies, and then the postganglionic nerve cell bodies will send out their fibers from the sympathetic trunks to innervate the esophagus. Sympathetic innervation of the esophagus inhibits peristalsis, just the opposite of what the parasympathetics do, and sympathetics will decrease glandular secretions that are coming from the esophagus. Next, we want to look at the splanchnic nerves that are formed from the sympathetic trunk. We'll see them course within the thorax, but it's important to remember that although they're found in the thorax, they do not innervate any of the thoracic viscera. Instead, they're going to continue on into the abdominal cavity where their functions are to innervate abdominal viscera. These splanchnic nerves are known as the greater splanchnic nerves, the lesser splanchnic nerves, the least splanchnic nerves, and the levels that contribute to their formation are T5 through 9, maybe as low as 10 for your greater splanchnics. The lesser splanchnics are from more inferior spinal cord levels, T10 to 11, and your least splanchnic nerves are going to be formed from preganglionic neurons that are housed within T12. We do see two of those splanchnic nerves in the illustration. One is more clearly recognizable. The lesser, we just see it forming. The least, we do not see in this illustration. But if we take a look here, we can see our greater splanchnic nerve coursing along here. This is your sympathetic trunk. And if we look, we can see some fibers coming from the sympathetic trunk at multiple levels that will course and then ultimately form this greater splanchnic nerve. Another term here, and the artist is using this, is major splanchnic. We also have the lesser splanchnic starting to form here. And again, T10 and 11 will help form the lesser splanchnic. Least splanchnic is not recognizable in this particular illustration.